I'm Ekene Ojukwu. I am a PGY3 in internal medicine at Johns Hopkins Bayview. So I actually didn't think I was going to apply to the medical education pathway. And that actually has to do with a lot of misconception I had about medical education. But I knew pretty much all through college that I loved education, and if I wasn't a doctor, I probably would have been some sort of teacher or some sort of like psychologist. And so when I came to med school, I saw the people who were teaching us, and I was like, that's cool, but I don't know if the kind of teaching I want to do is mostly hard science, and I don't know, clinical reasoning is cool, but I don't know. So I thought about it because I started to pay attention to who were my educators in residency. And I was like, I want to be like them. I think that they're amazing. I think that the way that they teach is not just about how we decide what is on the differential, but also how we communicate with patients. How do we analyze our interactions with the people that we're taking care of? And so I was like, I've always loved education. Maybe this is the avenue I can use to explore whether this is a path I would want to do. Do I want to be a clinician educator? So, it was being led by two people that I knew, and I was like, oh, well, I just get to hang out with them. So there's no harm in that. But essentially, I think I knew that I wanted to do education. I didn't know if that was the career choice I wanted to have, and I needed a place where I could explore what type of educational projects that I would want to do. And so the pathway seemed like a great option to try something out. The most meaningful part of the pathway for me has been the opportunity to just explore my own interests. So I'm interested in art and literature and the ways in which we can use them to teach concepts that are really important in the care that we deliver. So concepts around spirituality and decision making at the end of life, around pain and suffering, and thinking about how we can integrate those into the classic education that we do, right? So my interests are not necessarily the standard interests around kind of the biomedicine, but I've had chances to go to the Met, and I've had chances to talk with some of the people here who do work around visual thinking strategies, and I've had the opportunity to start playing around with literature and how that could be incorporated. So I think that this pathway allows you to do what you want to do, right? And just gives you the support to do it and to feel like it's a meaningful addition to the work of medical education. So the pathway, I think, was a major turning point for me in residency because it helped me to see that there were a lot of people who were like-minded, right? A lot of people who were interested in some of the same things and who were willing to be open about wanting to be there for learners and wanting to think differently about the work that we do in residency. And I think up until then, I had my friends and I had people who I could talk to about all sorts of different issues related to education. But I think being around a group of people who also see the issue that you're seeing and are actively trying to think of ways of making it better, who think that this experience of being a medical student and a resident and even fellowship should be one that elevates us. It should be one that is not just draining and exhausting, but also one that gives us life and makes us feel like we're in the right place at the right time. And so I think that having that community and just knowing that they're there, sharing time at noon conferences or at hangouts or during boot camp, I think it does more for you than you realize. And for me, I think I needed that sense of community more than I realized. So when I think about how the pathway has affected my thought about my future, I think it actually was transformative. I don't think I would have thought about being a clinician educator without it, right? So for those of us who go to a residency at an academic institution, there's a lot of emphasis on research. And so there's always some research project to be done. And so often we see people in those roles and we feel like that's what we need to do to be successful. And so when I started looking at people who were clinician educators, I was like, maybe I think I could do that, but I'm still trying to figure out what in this I would want to do and where I would fit, where would my niche be. And so I think being in the pathway and getting the chance to explore my own interests and having those interests validated made me feel like, oh, I can do this. I may not be the person who wants to do only, focus on bedside rounding, or the person who focuses on how to make the best diagnostic reasoning, which, we all hope to do. But maybe I can be the person who focuses on communication and how we communicate with vulnerable populations, and how do we use art to do that, and how can I create a curriculum and experience for learners of multiple stages to be engaged in that, and to realize that a lot of the work that we do is around communication before we prescribe any single pill. So I think it gave me the confidence to say, oh, I think I can do this clinician educator role. And then it also gave me the exposure to say, this might be where in the medical education sphere that I might fit in. And so I don't think I would have had that. I think I would have probably still felt really lost if I didn't have the space and the support to explore that as a career option. So for those who are applying to residency here at Hopkins and you're thinking about the medical education pathway, honestly, if you're thinking about it, just go ahead and do it. So the reason I say that is because one of the difficult things about residency is trying to figure out what you're doing residency for. Meaning, this is training, so it's training towards something, right? So what is it that you are training towards? And I think that these pathways that allow people to have space to just breathe and think and to reflect on what it is that is important to them is key. And to have that with a supportive team of people who can guide you, who can listen to your ideas, who can talk you through whether this may work, maybe pivot slightly, or maybe no, or maybe it's just perfect the way it is. Let's connect you to all these people. That is such an oasis in the middle of all the work that residency entails. And it helps ground all the stuff that you're doing in residency towards a purpose, right? And that, I think, is the kind of thing you need, because residency is hard, and residency is really busy and time consuming because you're learning so much so quickly. And the pathway gets to be something you do for yourself, right? You're doing it so that you can grow. You're doing it so that you can figure out what you want to do, who you want to be, how you want to teach, right? And I think that's one of the most important kind of spaces to have in training. And so I think that just thinking about what kind of spaces you feel like you're going to need in order to become the doctor you want to be is really key to, I think, your success in residency. So if you're at all thoughtful about medical education and you just want to have a chance to explore, to try different projects, to talk to different people, to be connected to different people, I think that the medical education pathway is for you. So you should just